So I love Modern Family. Great TV show, right? But one of the actresses in Modern Family, Sarah Hyland, she's had quite a few medical issues in her past. I know not recently, but recently she made it public that she's had a kidney transplant in the past. She has some chronic illness that made her get a kidney transplant, right? But on top of that, now there's another issue. I don't know exactly what it is. She did not tell us what it is, but she's in chronic pain, chronic pain, and it's been a long-standing issue. But she's frustrated with her doctors because they're not listening to her and taking that advice. So let me give you exactly what she tweeted out. She said, for those who are chronically ill and in chronic pain, have you had the experience where your doctors are not listening to you? If so, how do you not tear their heads off with your bare hands? I can understand this. I can really understand this. For you nurses out there, for us nurses, we know when you go into work, we have those patients that need to get some pain medications, that need to get some kind of treatment for their pain. Whatever the medication is, if it's morphine, if it's Dilaudid, if it's whatever you're giving at Q6, Q4, Q2, you know there's some patients that are in excruciating pain all day, every day, and you have to do that for them, right? With this humongous opioid crisis going on, I know, I don't want to even say doctors, I want to just say healthcare providers in general are just walking on eggshells trying to figure out what's the right thing to do. But understand something. Of course, the opioid crisis is crazy. It's scary. It's the worst thing ever. We don't want that for anyone. But pain is pain is pain is pain. Right? If someone says they're in pain, they're in pain. If someone's in pain, they can't concentrate on anything else. If they can't concentrate on anything else, there goes their health. They're not going to give a shit about eating healthy. They're not going to give a shit about doing the treatments that they have to get done. They're not going to care about anything else but the pain that's taking over their body. So pain is pain is pain. We got to figure out a way to help her subside this pain. We don't know the details. That's all she gave us. We don't know the details, so I'm not putting any blame on anyone. I'm just saying this story allows us to expand and talk about pain and how we treat that in the time of this opioid crisis. It's hard. It's difficult. I'm not even going to pretend for 1 second that I know what the intricacies in choosing what kind of pain med to give a patient. That is the doctor's, the advanced practitioner's decision. You guys take care of that. But I do know as a nurse, if I'm Sarah's nurse, I am paging you every 5 minutes on the minute to make sure you know that she's in pain. If I'm her nurse, I am going to make sure that you know as often as she wants me to let you know that she's in pain. It's difficult. It's hard. All right. So